We're going to move on to one of my favorite topics of all time, which is vaccines. So we are going to open up an informational meeting on vaccines. And I guess I will call forward Dr. Alanna Braun and Dr. Ryan Hassan. Are you, and then have you guys figured out who's coming when and all that? Are you just, okay, you have your choreography, interpretive dance, all of that. Thank you so much for being here today.
Thank you so much for having us. Chair Reynolds, Vice Chair Anderson, members of the committee. For the record, my name is Dr. Alanna Braun. I'm a primary care pediatrician and a member of the board of the Oregon Pediatric Society, which is the Oregon chapter of the American Academy of Pediatrics. If you had told me when I was a graduating medical student going into my pediatric training that I would be here today talking to you about these vaccine preventable illnesses, I don't think I would have believed you. The very next year, in my first year of pediatric training, I cared for many children in Northern California during a whooping cough outbreak. I watched children who were too young for the pertussis or whooping cough vaccine struggle to breathe and require significant medical care and long hospital stays because their community was not adequately vaccinated against pertussis to protect them. Today, in my pediatric practice, and as the mother of a toddler, I watch the measles case counts and I anxiously worry about the safety of my patients and my family. I think we are incredibly lucky to have access to vaccines. There was a study recently done that did some modeling and showed that in the last 50 years, vaccines have saved 154 million lives, which is 38.5 times the entire population of Oregon. Vaccines are safe. Adverse reactions to vaccines are extremely rare, and there is no link between vaccines and infertility, diabetes, developmental delays, or autism spectrum disorder. The measles vaccine is an incredibly effective vaccine. When the vaccine was first licensed in 1963, you can see here on the left of this chart that there were many hundreds of thousands of cases of measles every year in the United States. And even in our very resource-rich country, when children had measles infections, 1 to 3 out of 1,000 children died of measles, and that is not including any of the children that had severe medical consequences. There was a huge drop after we first introduced that vaccine, and then in 1989, it was recommended that children receive a second dose of measles, the immunization. In 2000, we actually declared measles eliminated in the United States, which again is how well this vaccine works when it is given. We rely on herd immunity or community immunity to keep our community safe. When enough people in a community are vaccinated against an illness, it keeps it from spreading. And the degree of herd immunity that you need varies depending on how infectious an illness is. And so something like the measles, which is incredibly, incredibly contagious, we're aiming for 95% vaccination coverage for the measles. And this is to protect children who are too young for the vaccine, people who have immunosuppression for various reasons, people who are suffering from cancers, from other illnesses where they're on medication that suppresses their immune system. And we are losing our herd immunity. So this chart starts in 2000 when we declared measles eliminated in the United States. And you can see there are occasional cases, and those were all previously from folks who were coming in from out of the country, and we did not have any spread within the United States. And then in the last 10 years, we've really seen a big rise in the number of measles cases. That biggest spike there is in 2019 when we had our measles outbreak here in Oregon and in Washington state. And the 2025 bar is already quite high considering that it is only April. Again, so thinking about like what level we need for herd immunity, so far we have been very lucky in this current outbreak, but we know that Oregon is at risk. We have many, many communities that have not reached that herd immunity level. This is the 2024 immunization data. So this is counties and how many children have received 2 doses of their MMR vaccine when they enter kindergarten. You can see there's only one county that hits that 95% mark. And all of that light yellow is 90% or below. And so we have many communities that are at risk of measles cases and outbreaks. This is fresh data from the 2025 school immunization rates. This is a bar graph that shows every single school with 10 or more children in the state of Oregon, K through 12. And again, we're aiming for that herd immunity level of, this is set at 93% is like our bare minimum that we need to keep kids safe. And 66% of schools reached that level. Last year, we had 69% of schools reach that level, and in 2023, it was 74%. And so that number is, it's been decreasing. And then I have that is currently, so we have 563 schools in Oregon that are at risk of measles outbreaks. We're also seeing decreases in our rates of complete immunizations in 2-year-olds in the state of Oregon. So that's another thing that we look at when we're in pediatric practices. And so you can see this top bar here is just showing the total number of children that are completely vaccinated with all the vaccines we recommend by age 2. And we were increasing up to 2020, and then since 2020, unfortunately, we have been seeing decreases. I do want to point out, however, that although these are decreasing, the vast majority of people are choosing to fully immunize their children.
Yeah.
And then one last thing that I know has sort of come to question again recently is whether vaccines and autism are linked, and no. There is no link between vaccines and autism. There have been multiple studies that have looked at the measles vaccine as well as individual ingredients in the vaccine, and those have all repeatedly shown that there is no link between vaccines and autism.
Can I ask a question? What about that study out of England?
Yes.
This was like 20 years ago.
Yes,
It was like
Chair
a
Reynolds.
watershed moment in vaccines.
Yes,
And
thank
of
you.
course, I do know the answer, but I'm teeing it up for Dr. Braun.
Chair Reynolds, thank you for that question. That paper that you are mentioning from Dr. Wakefield was published in 1998. It was subsequently shown that he falsified his data. It was a very small study and has been redacted, was shown to be untrue. He lost his medical license over that paper. And unfortunately, I think that is a big link of why we've been seeing these increasing cases of measles. And it has been very, very hard to overcome that in our communities. And I think a lot of families bring it up.
Yeah, there's been a lot of studies showing that, like the revelation of this link for all sorts of things, including like don't feed your kid peanuts because then they'll get peanut allergies, is stickier than revoking.
Yeah.
Yeah. So I think that's one of the things we're seeing here still.
Yes,
So,
agreed. Yeah. Thank you I think that's one, and I'm sure that Dr. Hassan sees the same thing of we are confident, and my child is completely, fully vaccinated, and I think that is one of the things we can sort of show people of our confidence in vaccines, but people want to do what's right for their kids, and they are afraid, and so we're trying to sort of help them feel safer and more confident.
Great. You had a question, Sarah?
Just,
Yeah.
I think the slide before, the bar graph that you showed, the colors.
Yeah, the
I
slide.
thought I heard you say that the numbers are down of
Yes.
late. But the piece I didn't understand, your observation was the parents fully immunized, and I didn't know, since we were talking about measles, does it just mean measles?
Sure.
Or what was intended definition?
So, Chair Reynolds, Vice Chair Anderson, thank you for that question. So overall, this graph is looking at, so each color represents a different vaccine, and then the yellow, so there's a lot going on here. This is from the Oregon Immunization Program public data, so you can also sort of dive deeper on all of these. The yellow on the left is children who have every dose of the vaccines that we recommend by age 2. And so that's what the total numbers are across the top here. So in 2018, 68.8% of 2-year-olds in Oregon had all of the recommended vaccines by the age of 2. And we peaked at 71.3% in 2020. And then in 2023, now we're back down to 68.3%. And then each individual color represents like the individual vaccines that are part of those groups. And so the measles, that is the MMR there in the middle, the sort of teal color. And so those ones are a bit higher. So the individual vaccines tend to be a little bit higher.
Thank you.
Yeah, absolutely. And then,
Yes, of course.
Thank you so much for your presentation. I have a question about cost. Could you tell me what this might, is cost a barrier to any family in accessing vaccines for their children?
sure. So your question, sorry, Senator Patterson, is what is the cost of vaccines to families? There is not one. It is the, I mean, there's obviously, cost of getting to your doctor's visits and things like that, but both through state and federal programs and through the ACA, vaccines are considered fully preventive care, and so families should not be getting bills for their vaccines and vaccine visits.
And furthermore, and I'm so sorry if you are unvaccinated, which we know is pretty unusual in Oregon for children because we have such deep and wide health insurance rates for our kids. But if you are truly unvaccinated, vaccines are free to you through a federal program. Uninsured, sorry. If you are uninsured, sorry. Vaccines are free to you through a federal program. And I remember being a pediatric resident standing in some public area and hearing the president at the time, Bill Clinton, announced the Vaccines for Children program and just thinking, wow, this is amazing. So so luckily there should never be a cost barrier to vaccinating. Thank you.
Yes, thank you. And I just wanted to put my final slide before I finished was just to sort of wrap up with kind of the 3 things that I hope you all take away from this today, which are 1, the vaccines are safe, 2, vaccines are extremely effective, and 3, the majority of people want vaccines and they want access to vaccines here in Oregon. Thank you.
Great, thank you. I will just say before you start, you're totally right. Like we didn't learn how to diagnose measles in medical school. I think I'm literally like trying to bone up on what measles looks like, the Koplik spots, all that stuff, right? The cough, coryza, and conjunctivitis. But my memories, because I'm old, is, I remember being a pediatric resident and doing spinal taps, which is getting a sample. Well, first of all, it's horrifying to think of spinal taps. And pus would come out, and this would be Haemophilus influenza meningitis or pneumococcal meningitis. As you can imagine, pus in the fluid that bathes your brain and spinal cord is very dangerous. And also in particular, Haemophilus influenza meningitis is highly associated with hearing loss. And so like those literally are things we, for the most part, don't have to worry about anymore in pediatrics because those were diseases that I saw and then became vaccine preventable in my career, which has been incredibly exciting and rewarding. And, I don't know if we can talk about all sorts of other things, but this is why I love this topic. Thank you. Okay, I'll try not to talk. You guys are the experts. Next.